Hey, Dr. Gullberg, continuing our internal medicine series. Today we're talking about peripheral neuropathy. And this isn't radiculopathy or spinal cord problem where there's a pinched nerve down the leg. We're talking about sensory or motor peripheral neuropathy. Most of these cases are going to be idiopathic, but we need to look for the cause to see if we can help our patients get to the bottom, get to the root of the problem. Diabetes is going to be a common cause of peripheral neuropathy. Obviously, we're monitoring our glucose tolerance test, FBS, or hemoglobin A1C. Second cause of peripheral neuropathy is vasculitis, such as polyarteritis nodosa. We're going to check a SED rate. We're going to check a CRP. Immune-related diseases like rheumatoid arthritis, lupus, multiple sclerosis are on the list here also. Amyloidosis is more uncommon. They may need a biopsy for that. Cryoglobulinemia can be obviously associated with cold-induced disease, but you want to check your cryoglobulins as well. A lot of the B vitamin deficiencies, B1, B6, B12, can all cause peripheral neuropathy, as can vitamin A deficiency, vitamin D deficiency, and vitamin E deficiency. Make sure you check the TSH for hypothyroidism. And, of course, cancer through a paraneoplastic syndrome can cause peripheral neuropathy, such as lymphoma. Alcohol abuse and alcoholism, excessive alcohol can cause peripheral neuropathy. That's very common in the U.S. Uncommonly, porphyria, but certainly you want to check a urine for PBG. Infections like Lyme disease, herpes zoster, leprosy, HIV can cause peripheral neuropathy. And then there's the autoimmune diseases that can cause often a motor neuropathy, where we want to check the anti-GM1, the ganglioside antibodies, to see if those are positive. In terms of treatment, we start with tricyclic antidepressants like amitriptyline, but then the anti-epileptic meds like gabapentin or valproic acid are helpful. Then we step up to the pregabalin medication, Lyrica, which is more expensive. And of course, you have to watch for side effects such as edema. Duloxetine or Cymbalta, which is a serotonin norepinephrine uptake inhibitor, can be very helpful. If these fail, then we have to look using things like TENS units, which stands for transcutaneous electronic nerve stimulation. And if it's an autoimmune problem related to sometimes a paraneoplastic syndrome, then IVIG or cyclophosphamide might be helpful. So this is a quick differential diagnosis of peripheral neuropathy, some of the tests you should order, and how to treat. Thanks, Dr. Gullberg, signing off.